Hello, my name is Yashika Chambers Radigan, and I'm here to do a head-to-toe assessment for you today. Can you please state your name?
My name is Alton Radigan,
Okay, and your date of birth?
9/20/1978.
Okay, and do you know why you're here today?
Yes, ma'am, I'm here for an head-to-toe assessment.
Okay, great. Okay, all right, Mr. Radigan. Like I said before, we're gonna do a head-to-toe assessment. We're gonna start from your head, and we're gonna move down to your toes. Okay, so before we do that, I'm just gonna get my hands clean. Okay.
Okay.
Okay, great. So first, I'm just gonna take a look at your face. Okay. I'm gonna check both sides to make sure they're symmetrical. Okay, so both sides of the face symmetrical. There's no drooping on either side of the face. Okay, I'm just gonna take a look at your ears. Okay, ears are also symmetrical, no deformity. I'm sorry. Just gonna check your lymph node. Check here. Okay, so there's no swelling on either side of the neck. There's no lump noted on either side. Okay. All right. I'm just gonna check your carotid pulse. I'm gonna palpate one at a time. I'm gonna do the next side. Okay. So pulse is strong and regular bounding +2, which is perfect. Okay. So Mr. Radigan, I'm gonna look at your eyes. But I'm just gonna dim the light. I have a little flashlight here to look at your eyes, but first I'm gonna dim my light, okay?
Okay, thank you.
Okay, so I'm back. All right, so just gonna use my light to look in your eyes, right? Perfect. I'm just gonna put the lights back on, okay?
All right.
All right. So Mr. Radigan, now I'm just gonna ask you to just follow the pen for me. Okay, great. So the eyes are equally round. They're reactive to light, they constrict and they dilate, and there's accommodation there, which is perfect. Okay. All right. So next, I'm just gonna take a look inside your mouth, but before I'm just gonna look at your lips. So lips is pink and moist, which is good. I'm just gonna use the light just to look inside your mouth. Okay. All right. So the teeth, white. There's no missing or loose teeth. Mucous membrane is pink and moist, which is perfect. Can you stick your tongue out? Okay, tongue is pink. There's no lesions noted. So everything looks good inside your mouth. Okay? All right. So now, I'm just gonna check your apical pulse. But before that, I'm just gonna look at your arms before we check your apical pulse. Okay? Can you just stretch your arms out? All right. So I'll inspect it. There's no redness. There's no swelling. Can you just flip them? Just gonna check your pulse here. Okay, so pulse are symmetrical. They're equal. Bounding +2, which is perfect, strong. Okay, I'm gonna ask you to do two things for me. I'm gonna ask you to flex your elbows, extend. Any pain while doing that?
No, ma'am.
No. Okay, I'm gonna ask you to rotate your shoulders for me. Any pain while rotating your shoulders?
No, ma'am.
No. Okay. Can you just flex your wrist? Any pain?
No.
Okay, great. All right, so I'm just gonna check for temperature right here. So skin is warm to touch, dry, which is good. No abnormal temperature there. I'm gonna check skin turgor. Just gonna pinch on your skin for a little bit, okay?
Okay.
All right. So skin turgor perfect. Snap back within briskly. So that's perfect. Let me check here. Skin turgor perfect. Snap back briskly as well. I'm gonna check capillary refill for you. I'm just gonna press on your nail bed, okay?
Okay.
Capillary refill is good. It returns to normal color within less than 3 seconds. Next one, I'll check this one. Okay. Capillary refill on this one is good as well. Return to normal color less than 3 seconds. Okay. All right. I'm gonna ask you to squeeze my fingers. Okay. Press back on my arm. Okay, that's good. I'm going to ask you to, strength is good. Good strength. That strength was good. I'm going to ask you to close your eyes. Just tell me which finger I'm touching right now.
I'm touching my left thumb.
Okay, so sensation is good. All right, so active range of motion, perfect. There was no contraction. There was no pain while executing active range of motions. So everything looks perfect there. Skin temperature is fine. Sensation is good. Capillary refill is good, and skin turgor is good. Okay, Mr. Radigan. So now we're gonna move on to your apical pulse. Okay, would you mind removing your shirt for me, please?
Not a problem.
Okay, so to get your apical pulse, we have to find the maximal point of impact. Okay, all right. So now I'm just gonna clean my stethoscope before I check that pulse. All right, so let's first find the maximal point of impact. Okay, so now we're gonna check the sternal notch. Okay, so we're gonna find your sternal notch. We're gonna move down to the ankle fluid. It's about right here. We're gonna go lateral to mid clavicular. It's right here, which is the second intercostal space. So we're gonna count down to the fifth intercostal space. So it's gonna be 3, 4, 5. All right. So fifth intercostal space would be right here, and it's mid clavicular line. Okay. So I'm gonna listen to your apical pulse for a full minute. Okay.
Okay.
And we're gonna start right now. Okay, Mr. Radigan. So your pulse is 82, which is normal, and it's also the rhythm is also regular. Okay. Next, we're gonna listen to your lungs. Okay. So we're gonna listen to your lungs anteriorly, lateral, and posterior. Okay.
Okay.
All right. So I'm gonna ask you to take deep breaths for me. Okay. Good. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay, so we're gonna listen to your lungs posterior now. Just turn around. Can you turn for me, please? So deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, that's great. So Mr. Radigan, your lungs was clear upon auscultation. There was no abnormal or adventurous sounds noted. Okay, so that's good. All right. So now I'm gonna check your abdomen, and I'm gonna listen for bowel sounds in all 4 quadrants. Okay. So would you mind laying down for me, please?
No problem.
Thank you. Okay. All right. So first, I'm just gonna look at your abdomen. Your abdomen looks round, looks normal. No, it's not distended based on just looking at it. Okay, that's good. All right, so now I'm gonna auscultate. I'm gonna listen for vowel sounds in all four quadrants. Okay, so I'm gonna start with your right lower quadrant. Then your right upper quadrant. Your left upper quadrant. Then your left lower quadrant. Okay, great. So vowel sounds were heard in all four quadrants and they're within normal limit. Okay. Is there any pain in your abdomen?
No, ma'am.
Okay. So I'm just gonna press on your abdomen a little bit. Is there any pain while I'm doing this?
No.
Okay, no pain. So the abdomen is soft, is non-distended, round, and see it appears normal. No pain while palpating. There's no pain while palpating. Okay, Mr. Radigan, that's great. All right, so now that we did your abdomen, we're gonna move down to your lower extremities. Okay.
Okay.
All right, so I'm just gonna inspect your lower extremities just to look to make sure they're symmetrical. So lower extremities symmetrical, no deformities noted, no lesions on either side. All right, I'm just gonna check for temperature. Okay, so skin is dry, it's warm to touch, which is normal. Just gonna check pulse. So I'm gonna check your dorsalis pedis pulse. Okay, so they're equal, bounding, +2. Okay, the next thing I'm gonna do, I'm just gonna check for capillary refill. So I'm just gonna press on your nail right here. Okay, capillary refill is good. It returns to the normal skin color within with less than 3 seconds. Okay, check next side. Capillary refill is good. It returns to normal color within 3 seconds. Checks for skin turgor. Skin turgor is good. The skin snap back rapidly to its normal position. Also, I'm gonna check to make sure there's no edema. Okay, so there's no edema noted. All right, so can you just close your eyes for me? Can you tell me which toe I'm touching?
You're touching my left big toe.
Okay, great. All right, can you push back on my hand? Okay, so strength is great. Can you flex your knee for me, please? Can you straighten? Any pain while doing that?
No, ma'am.
Can you raise your leg? Any pain?
No, ma'am.
Can you raise the other one? Okay, any pain?
No.
Can you flex your foot? Can you dorsiflex? Plantar flex, dorsiflex, up, down. Any pain while doing that?
No, ma'am.
Okay, so that's great. All right, so range of motion is perfect. There is no contraction and no pain while executing range of motion. Okay, so that's great. Also, Mr. Radigan, I'm just gonna ask you to just we're basically done here. So I'm just gonna ask you to sit up for me.
Okay.
So in the lower extremities, sensation is good. Strength is good. There was no edema noted there. All right. So just gonna wash my hands, just clean my hands again because we're basically done there. What I'm gonna do, I was looking in your chart and I realized that you were recently diagnosed with diabetes and you're currently taking insulin. All right, so I just want to reinforce that before you take your insulin, just make sure you check your blood sugar prior to administering your insulin. Okay, because you don't want to have your blood sugar too low and then you administer your insulin, then you're going to get hypoglycemic, which is not good. It's just as bad as being hyperglycemic. So I encourage you to check your blood sugar before you take your insulin. Also, eat in small portion. Avoid carbonated drink, sugary drink. Your intake, low sugar intake, low carb intake. Okay. We're not telling you to starve yourself. Just eat in smaller portions, rather than having 3 big meal. Just have smaller portions. Okay. Also, hydration is good. We encourage you to drink water, a lot of water. That's good for you. Also, exercise. Exercise is very important. We encourage 30 minutes, at least 30 minutes of exercise, 5 days a week. Okay? Also, if you're home and you feel outside your norm and you feel the need to contact your healthcare provider, feel free to do so. If it's the middle of the night and they're not available, feel free to go to an emergency room just to make sure everything is okay. All right? Do you have any questions for me?
Not really any question. I'm just glad that you have just said it's very important to check the blood sugar level before I actually take the insulin, because I usually do it without checking. So thank you for that information. Also, thank you for letting me know that hydration is very important.
Okay.
Because someday I would love to get off these medication.
Okay.
All right. Thank you so much.
Okay. That's great. Thank you too, Mr. Redigan. Okay. All right. Take care of yourself and have a good day.
All right. You do the same.
All right.